First up, Greg Barnes graduated from Michigan State University in 1982 with a degree in journalism, and you've read these bios, I'm sure, but I'm just going to read a real quick summary of them. After college, he worked for a year as a stringer for the Grand Rapids Press and spent 2 years with the Brazel Sport Facts in Texas. I'm not sure what that is, but you can tell us. Oh, okay. Before heading to Fayetteville, North Carolina, and he left Fayetteville for Shreveport Times in '86 and returned to Fayetteville as an editor 3 years later. And he is there today. He has indulged in SOJO, Solutions Journalism. He's going to talk to us about what he does and how he does it. Right.
Thank you, Fred. This all started in 2013. My boss went to a newspaper conference in Washington, D.C. He met Tina there, and they got to talking, and he came back all buzzed up, and he said, Greg, I would like you to do something with solutions journalism and how it can reduce our crime problems. And I'm like, what is solutions journalism? I could be glad to do it, but I have no idea what it is. So he said, just take a month, go and see talk to the folks in the community, see what our problems are and what they think we can fix, how we could fix them, and we'll go from there. So I come back a month later and I said, well, I heard something really good about High Point, North Carolina, which is just up the road, and it had replicated David Kennedy's ceasefire, and had reduced crime by 60% with this effort, and it was sustainable, and then they grew off of that to do deferred deterrence, and so I said, well, why don't we go there, and not only that, but why don't we look at best practices around the country? So off a photographer and I went to High Point, our first one, and somewhere before we got there, we found out that not only was High Point still doing this, but Chattanooga was just starting to do it. So we started off in High Point and then took a 7-hour car ride to Chattanooga and found out how they were trying to go about just starting this. So it's fairly interesting. This first slide is High Point. So we went there, spent 2 or 3 days, and then went to Chattanooga, wrote a sidebar on Chattanooga, and came back with, I thought, one of the better ones in the series. From there, we went to Memphis to do a story about collective impact and how they had used this collaborative effort to reduce crime, 22.8% for violent crime, and just what was so interesting about Memphis is that they did it. This collective impact board, they took everybody in the community was on the board, the big steering committee, and then from that they developed strategies and did a lot of research, identified the problems, and then went after and attacked them. This one, I had a Guggenheim Fellowship in New York City, and I had this planned out before I left, and I didn't like it. I had seen something in Memphis that I thought was really interesting, but it just didn't hold for a great story. So I went to Guggenheim. We got snowed in for about 4 days. Ran back, met a woman there, Carol Naughton, who basically taught us about what they were doing in Eastlake, Georgia, right outside part of the community in Atlanta. So we went there and found out everything we could about reducing blight and cleaning up a community that had been really bad for a very long time. And on the way back, we stopped in Spartanburg, which is doing a similar type of program, and it was more tailored to what I think our needs really were. This one, our police chief had just come from Charlotte, North Carolina, so we went and said, okay, he's doing great jobs up there, or he had been. That's why we hired him here for community policing. So let's take a look at what he did up there. So we hauled off and went to Charlotte. This is the Steve Teskey, the judge, juvenile justice judge in Jonesboro, Georgia. We went to Pittsburgh for mentoring, and they just do a phenomenal job. They have this program called every kid in 6th grade gets a mentor. And from this, we in Fayetteville started our own mentoring campaign that seeks to double the number of mentors. This one was a little bit weird. My boss said, Greg, I want you to stay home this month because we had a bunch of kids killing each other. So we stayed home and looked at we didn't offer a solution. We just said, there almost isn't any solutions. This is getting so bad. Then we went to, this is Tulsa, to look at community or early childhood education. And in Oklahoma, they have universal early childhood education. So everybody qualifies, regardless of poverty. We got to stay close to home for this one. It was a prisoner reentry program, a small outfit, very little funding behind it. What they did great was they didn't catch these guys out of prison. They caught them when they were still in and taught them before they let them out. So they went through like a 16-week training course, and again had just phenomenal effects of reducing recidivism rate. We went back to High Point because they do a really good job of community building. They use people in the community actually help the police, and we thought that was a great way to, keep these people, get some help for police, which we don't do very well in Fayetteville. So. And then lastly, we went to Minneapolis. They have, I had no idea, but they have a very bad crime problem up there as well. And the mayor there, he went to a conference and wrote down 4 strategies that could be used to fight juvenile justice. And he came back from the conference, and those strategies are still working today. So basically, what's come out of this is we've had a mentoring campaign started. We have started a reentry council is just getting off the ground. 2 weeks ago, they held a job fair for the reentry council. Held this job fair for felons. 700 of them came out. So. And then we have just started forming a collective impact board of our own. And actually my boss sits on that panel, so that's what we've been doing.
You ended right smack on the minute. Thank you, Greg. That's amazing. The play that you gave those articles on the front page compared to the other news. Did you real quick, did you find your readers engaged?
Absolutely.
Yeah, you were able to see that.
We don't have good metrics,
but
yeah. We knew that in the community was talking about it.
Yeah, that's great. Monica Campbell, next. There you are, Monica. Focuses on immigration coverage in the United States. She works with a network of journalists based throughout the country to uncover how America's shifting demographics are changing everything from culture to politics. Before joining The World, Campbell reported internationally from Europe and Afghanistan, and from Latin America and the Caribbean. And from her base in Mexico City, Campbell's stories range from indigenous education along Nicaragua's Mosquito Coast and the investigation of civil war crimes in Guatemala and so forth. Monica.
Thank you. Let me just grab my computer. Who's using that too? Your adapter. Thanks. Hi, everyone. So let me just get hooked up. I work for a show called Public Radio International's The World, and I know it airs here in New Hampshire. And I'm based in San Francisco, and after this I'm going to go into the newsroom where they suck me in every once in a while at WGBH and work from there. And let me see, here we go. All right, I want to do this. And it should come up. Should this come up? Oh, here we go. Perfect. So I work with, like you said, I work with a network of reporters throughout the country. I'm an editor, but I also report as well. And some of the stories I'm going to be talking about were actually signed by me and reported by others. And like I said, I cover and manage our immigration coverage in the United States. So small beat. Basically, anybody who's in the United States with roots from elsewhere in the world, that's my territory. So I'm really swamped all of the time. But at the same time, what I also look for is how do we connect what, a lot of the issues and challenges that immigrants in the United States, how do we connect their issues to our audience, which for the public radio audience is mostly male, mostly white, and so not a lot of immigrants listening in on public radio, but these are shared issues and problems that we have across the country. And when you talk about immigrants and specifically health, there's one issue that comes up right away, everybody mentions it, and it's diabetes. And I knew that we wanted to get to something to do with diabetes. We'd read a lot of stories that immigrants in the United States have diabetes at a higher rate than non-immigrants. And we saw a lot of articles out there explaining why, and the reasons are very complex, having to do with hereditary issues, to moving to the United States and adopting a higher calorie diet, and the list goes on. I was interested in looking at projects in the United States that focused on this population here and what could be done differently. And this story caught my eye, and I'll tell you a little bit about how, some of the nitty-gritty about how we got to it. Sonia Narang, first of all, great reporter who'd already been working on public health reporting around the world. So she had an idea of how to look at a story analytically and ask some of the right questions going into it. So first of all, there was a reporter who was already well equipped to be able to tackle this story. And we thought about some of the ingredients that we wanted to look for or identify when it came to a project, because there's a lot of projects that work on immigrants and on diabetic immigrants in the United States. And this particular project in San Diego, it's called Project Dulce, had some of the ingredients that we thought lifted it a little bit above the norm to make it seem that this was something that that we could pay attention to. And we also saw that this small project was starting to be replicated in other parts of the United States and along the US-Mexico border. So something was happening right that other people were also identifying with and sharing. What I also thought was interesting, so basically just to recap this story, it's a project that works out of a community clinic in an area of San Diego where you have the highest concentration of Iraqi refugees in the United States. It's called El Centro. It's right outside San Diego. And what they do is they have health educators and promoters go to a clinic, and they do outreach in the neighborhood, in the Iraqi neighborhood, and they offer classes in Arabic to people who are newly arrived from Iraq who have diabetes. And at the end of the class, you get a certification, but it's also a class that's taught by immigrants themselves who have diabetes and also translated into Arabic. So you had this real buy-in from the community that this wasn't something where they would feel as an outsider or there was no cultural connection. You actually had a language connection and you had a cultural connection, which for a lot of immigrants, those can be the two breaking points when it comes to bridging that gap between services and actually having people show up for them. So we actually saw that the classroom was slowly filling up. The class was also offered in Spanish. But what struck me was that it was going after a population, the Iraqi refugees, that to me showed sort of a next tier of outreach. So we hear a lot about Latino immigrants. This was actually going to the next demographic wave in this particular area. So that also struck us as interesting. And they were showing results. So Sonia did quite a bit of reporting talking to people independently at UCSF and different health medical professionals who'd looked at this program and had also shown that they saw that there were a number of positive results coming out of this program. So we had some data to anchor with this particular project. Now, it wasn't perfect. At the same time, Sonia finished her reporting, we looked at the first draft, and I thought, okay, nothing's perfect, there have to be some challenges. And one of them was that the classroom size was still quite small. You still only had 5 Iraqi refugees in this particular class that she was monitoring. So what was happening? There was still a lack of community outreach. They were still having a hard time going out into the community and letting people know about this project. You also had a lack of Arabic-speaking translators and or health instructors. So they were hitting a wall when it came to offering more classes at times that were more convenient for the people who needed that. They had plenty of people speaking Spanish. Spanish was not an issue. But Arabic, that was more challenging. So that was something where we could see that this program could hit a limit. So this article actually, and with public radio, I've got 5 minutes. I don't have the amount of time that you have in print or to do 10 series, although we can do series. But really what I have to do with radio is to be capturing people's ear, oftentimes 3 or 4 times within one 5-minute story, because stoplights and people lose their train of thought, or they lose the momentum of the story. So you have to dive back in and remind people what the story is about that they're listening to. So it's a very tricky process when it comes to storytelling in a very small amount of time, connecting people nationally with a population that they may have absolutely no connection with. So in the host intro that our host Marco Werman, which you don't see here, gives at the top of the story is, you may know someone with diabetes, public radio listener, but if you're an immigrant, you might know 4 people with diabetes, and that this is a real issue. So at the top of the story, we've got to hook people in. Why is this an issue that we should all care about? And I think with solution journalism stories, to me, that's something I think about a lot when we embark on them is, well, this is an issue going on with this community, but why is this a collective issue? Why is this an issue that all of us should care about? Because in this instance, higher healthcare rates, people going into the emergency room for problems that could have been treated much earlier, etc. I want to know how much more time I have. Oh, okay, shoot. And then this was another story by Shuka Kalantari in San Francisco about prenatal care for Latinas who often feel isolated from the healthcare system. And this was about making it more of a community event and it was group prenatal care, so it wasn't one-on-one, so it created a bit more of a community for the women, and you saw as a result higher visits, more visits to the hospital in terms of checkups and things like that could normally get avoided. So that's an example. And then a piece I did was, I was in Mexico recently, and I was looking at the vaccination and also the push against vax in the United States, and I was in Mexico, and I noticed that I happened upon National Vaccination Day in Mexico, which we don't have here. And I dug in and I realized that Mexico has an incredibly successful vaccination rate. Very complex reasons why, but one of them is that they actually make getting vaccinated fun. So this was like this party environment at this elementary school in Mexico City, and all the kids are jumping around and the parents are there and the mayor's there. And this is a regular thing. This wasn't just politics. This was, I'm getting vaccinated today. And it was the mindset of that moment was completely different than some of the mindsets that you can witness here in the United States. And they also do tons of outreach and things like that, and they also have limits. But I found this story particularly interesting and as a side-by-side comparison to how vaccination can be viewed in the United States. So that's just a sampling of some of the stories that we get to. And I'd love to just answer any questions or take one of yours when you get a chance.
Thank you very much. That's really interesting. We're going to have questions after everybody's spoken, and that's what we'll do. We'll have all the speakers come up to this table after everybody's had a chance to speak, and then it's Q&A. Everybody has a shot. Okay, thank you, Monica. I'm particularly interested in being broadcasting about that time constraint that you mentioned, the 5 minutes. I live with that too, so I know what you mean. Liz Goodwin. Liz, where are you? There you are. Covers criminal justice, immigration, other national policy issues for Yahoo News. She focuses on telling the stories of people affected by political decisions, interesting, made far away from them in Washington.
Hi, thank you. It's great to be here. So I definitely come from a tradition that is very suspicious of solutions and solution journalism. And to illustrate that, I recently had an email exchange with my editor where I was updating him on my progress on a story, and I had gone out to basically spend a couple days with a woman who had gotten her life sentence commuted by Obama as part of his push to reverse some of the very draconian drug sentencing. And I wrote him and I said, oh, it's terrible. Her daughter doesn't like her. She can't get a job. Their house is in foreclosure. And he wrote back and said, great. And clearly we don't think it's great that we're not bad people. We don't think suffering is great. But there's sort of, I think, a feeling that the more terrible the story, the more sort of heartstrings you'll pull, and then the bigger impact you'll have. Then everyone will say, hey, why don't we do more for people when they get out of prison? This is awful. This lady's having a terrible time. And I think that talking to Tina really changed my whole view on that. I was actually working, I wrote the veteran story that you guys have, and I had already been looking into it, and I was like, I don't know if there's a story here. These seem to be working. I was like, oh God, snooze alert. And I literally was gonna not write the story, and Tina had come to talk to my editor and some of us about these workshops she was doing, and she was like, that sounds like a story to me. And she was right. I guess there's sort of a feeling that to have impact, you have to uncover wrongdoing. You want to find a scandal, basically. But something that I've learned is that it's scandalous if there's a solution and people aren't using it, or people are wasting money on something that's not a solution when there's actually a better program out there. That's a scandal. And now I think there's a part of me that asks, well, is there something that does work? And what does work? I think that's always in the back of my mind. And there's still, tons of stories where I don't think there is a solution. And I think most of the stories I write are not solution stories by any means, because either it's a breaking story or there's no solution. but it's just sort of changed the way I approach things. So even with this story where everything's so terrible and this woman's house is being foreclosed and that's so great for me, you know, I'm thinking about like, well, are there reentry programs that work? Which I guess Greg highlighted one in Fayetteville, and that's just sort of an orientation I'm bringing with me at all times when I'm reporting, and sort of looking for, and even the way I'm looking at Obama's like new push to do more commutations, I'm sort of seeing that as a solution story in a way, because his solution to a problem of the fact that there's people who are in prison now for like life sentences, where if they were sentenced right now for the same crime, they would get significantly less time. So his sort of solution to that is to increase the use of his pardon power, because they've been unsuccessful at passing retroactive sentencing changes that would let those people have an opportunity to get out. So it's just, yeah, it's just a different orientation for me, and I think it's helped me, you know, be a better reporter, and it's helped me realize that not all solution stories are like Upworthy, like watch a golden retriever, like kiss an angel or something. Like it can be serious, and it can be really impactful.
Thank you. Thank you, Liz. It changed you. I'll ask you about that later. Jesse Hardman. Jesse, where are you? There you are. A multi-platform journalist based in New Orleans, currently covers coastal issues for WWNO, New Orleans Public Radio, and runs the community media project, The Listening Post. He's taught journalism and media development at Columbia University and the City University of New York. It's all yours.
Thanks a lot. Thanks for having me. There's two stories there from me. I'm a teacher as well, so I am notorious for giving too much homework, sorry. These are just a couple of elements that I think help me when I'm working on a solution story, things I look for. And I'll give examples of each one of these, but connecting to people, getting perspective on the issue that you're looking at, and then also movement, kind of looking ahead. Let me see if I got this right. All right. So I wanted to include this story because this is something I did before I'd ever heard of solutions journalism. And I think it's an interesting example. It could have gone in a certain direction, and it wound up going in a very different one. I found out about this program that Bard College runs, which is in the Hudson Valley. And it's college courses for people who are incarcerated. So I went up to the graduation to check it out with a sense of my story probably would be about the graduation itself. But I rode up in a van with family members of people who were graduating. And you know, over the course of a 2-hour van ride, you talk to people. So I wound up meeting this woman, Bree, and she had just gotten engaged to one of the graduates. And so got to know her on the van ride, and then got to know her fiance in the cafeteria after graduation, where we were all allowed to hang out with incarcerated graduates. And just spending more time with them, and then afterwards following up and talking to a variety of people, my story changed a lot. It wasn't just about, hey, there's this program. It's, you know, there's this thing going on with this couple, and here are some of the perspectives on that. It's people, so you can connect to this example. I saw in Tina's presentation, she mentioned Richmond, California. There was a really good radio story recently about how they're paying people to not commit crimes. I don't know if you heard this on This American Life, but one of the quotes was, you know, who would you rather your neighbor be? One of the people in the program says towards the end, and it reminded me of this guy. So it's kind of a story that has legs to it. Here's an excerpt from it. And you can see, you know, I don't even get to talking about the Bard College initiative until the middle of the story. So I start with this character. There's these people, you can relate to them, they're in love. There's this guy who's, you know, trying to turn his life around. And these are the different ways he's doing it. And here's some people outside of that situation, you know, who can comment on it. The priest at the prison, another former convict. So surrounding them with people who can kind of analyze this is whether or not it's a solution. What does it actually mean that he's getting educated? What does it mean that if you know, are allowed to get married in prison, does that help you in terms of who you are when you come out? You come out with a support system, most likely, if it works out. So it's just an interesting way to look at this issue. And, you know, I think we get stuck with the headline of there's 2 million prisoners in the United States, a quarter of the world's prisoners, and we stop there. And we don't get to know them. And 2 million is a lot of people. That's a variety of people, a variety of experiences. So focusing on somebody who is trying something a little different, I think, helps people see, remind them that people who are incarcerated are people, and they might be your neighbor. They're going to get out at some point, a lot of them. So who are they? And what are the programs that are out there that are going to help them integrate? So this is an example that I would post-include in solutions now that it's been created, and I feel like it has a lot of the elements. It could have gone towards some of the examples of what isn't a solution story, and I feel like it went in the right direction. I, right now, cover coastal issues for New Orleans Public Radio, and Louisiana has one of the highest rates of coastal loss in the world, which is a combination of saltwater intrusion in the coastal area, sea level rise, and it's a really interesting issue to cover. I'm funded by the Walton Foundation, which is an example of how a lot of, especially public radio, is covered at local stations now. Is it's funded by foundations. So this is post-Gulf oil spill money that pays me to cover this issue. And what's interesting about it is it's a slow-moving car crash. It's getting worse. I go down to the coast and I see communities that are disappearing. You know, all that's left is this skinny piece of road to get to some of these houses, which are up 20 feet, you know, on stilts now, because when the water comes in and the storms come in, that's the only way they're going to avoid flooding. I was actually talking to my table about a solution-esque story I'm working on right now, which is what does it mean to elevate your house as a solution to actually staying in your community, in your neighborhood? Why would you go that route instead of moving? What does it cost? What are the realities of that? So it's a huge issue. I've been covering it for over a year now, and I've been doing it little by little. There's a million different small solutions to this big issue, and I try and cover them individually and look at all the different perspectives on them. And thanks to solutions, I was actually able to go to Vietnam because they have a similar problem. And that gets me to my second point, which is perspective. After spending 6 months kind of engrossed on the coast of Louisiana, going to Vietnam helped me get outside of all these things that have kind of, you know, solidified in my head and see them through the eyes of a similar situation, but some different approaches, some different solutions. And what was great for me was I took the same approach. I really focused in on smaller examples. So this guy was my favorite person I met. He is a local tractor repairman in Ho Chi Minh City, and he put up his house something like 4 or 5 feet with concrete, much higher than his neighbors, because his alley floods every time it's the rainy season, which lasts 5 or 6 months. So it's a real problem for this community. He knows where he is that the government isn't coming to save him. There aren't social programs to help him out. He's going to have to find his own way to survive and stay in this community. This is a quote from one of the scientists I spoke to when I was there. And while he's coming up with ideas of how the city might restructure itself to help people out, he also knows that people are going to find their own solutions to these problems. And those are often some of my favorite stories. How are people just adapting? You know, how are they figuring out how they're going to stay where they're from, and why is that important to them? So we played these stories on the air in Louisiana, and that was interesting because there's a large Vietnamese community there. A lot of people came after the war, resettled, so there's a connection there. It's also great for me because our listening audience extends all the way down the coast. New Orleans is a city, and it has kind of who you would imagine is there. But when you get down onto the coast, that isn't necessarily a public radio audience. So covering the issues that most affect those communities, can I stay here? What does that mean for my future? Interviewing people from those communities, offering kind of some of these solution-oriented stories, help us get new listeners. Because most of the other coverage is, this is bad, it's getting worse, how are we going to fund it? Instead of, these are the things people are trying. And people love that. They love hearing their neighbors. They love hearing people from their communities that are trying things that are familiar to them. And then again, sharing this story, it's a perspective outside of their situation. How are other people doing it? And we had an event after we aired these stories and invited people, and 60 people came to a bar in New Orleans, which is great, which is where everything happens in New Orleans. But they were able to meet us, talk to us about their solution ideas, and it was a really great kind of extension of that story. I also try and fit some solutions in spot news. So I have to do, 1-minute radio stories, which are really hard. You're literally, working with 200 words sometimes. And this is just a quick example. New Orleans floods a lot, and one of the reasons it keeps happening is because the infrastructure is outdated. And so the city is trying to consider new green infrastructure ideas, change their zoning ordinance. Instead of doing what all the other news outlets did that day when the city flooded, which is the city's flooded, I called up a landscape architect and asked her, well, what are some of the things that are out there that might, change this problem, make it a little different when it rains? And so in a minute spot, I offered a few solutions to something people were experiencing that very day, which is trying to drive home through, 2 feet of water, trying to get to your house. So it's not just, New Orleans flooded again, it's New Orleans flooded again, and here are some of the things that people are thinking about in New Orleans that might change that on your drive home, something to think about. So yeah, finding small opportunities to include, pushing that story forward. So people, perspective, and again, when I say movement, I'm like, it's very intuitive to radio. It's, what's next? Radio's active, right? What's going to happen next? So I think it's really easy to include this idea of like movement, of forward movement. Great. Yeah, thanks.
Thank you, Jesse. I've been in New Orleans in that water, so I know what you're talking about. Okay, John Higgins, there he is. The Seattle Times in 2013 is a beat reporter covering K through 12 education, and is one of 2 primary reporters for the Education Lab Project. He was a Knight Science Journalism Fellow at MIT in our neighborhood. John.
Okay. So now we'll really see if you did your homework. How's everyone feeling? Are you feeling, remember this mood meter? You feeling a little in the blue, bored? I hope not. You might be ecstatic up in the upper, in the yellow. That maybe you're drinking too much Kool-Aid. I don't think they want you ecstatic about solutions. But I'm somewhere in yellow and red, a little anxious, a little nervous, following these great journalists. I thought I'd start just with an overview of EdLab in Seattle, which is in our 2nd year. I joined last year filling in for the main EdLab reporter on the K-12 beat, and then when she went to become the editor, I came in to fill in her space. So this is my first full year doing EdLab. So let me click. Hey, here's what we've done so far. I'll just let you read it. Some major stories. We have a blog that's a couple entries a day, and the EdLab reporters write a substantial post once a week, so among us. And there's usually a report. It's not like, hey, something cool on the internet, take a look. It's fairly reported. I tend to focus my blog posts a lot on, I'm really interested in research in neuroscience and cognitive science and education. And so I find that framework useful to get that kind of stuff into the paper or onto our blog that normally wouldn't have a home, but it fits with our themes of EdLab. We're covering stories from preschool to college and everything in between. This year we've been trying to follow some themes. Last year was kind of a lot of individual stories, not necessarily tied together. This year we're trying to use the framework to kind of follow some themes. One of our themes is on discipline. Claudia Rowe has been our main reporter on that. And so she's used these series as a way to develop the issue a little more than you could in one story. And so one of her first stories really expanded more on the problem than you'd usually do in a solution story. But we felt like we had to do a little more table setting before we could get into some of the various solutions. So this has been very popular, very well received in the community, and in fact, we just had an event last Saturday, and I think there's one coming up on discipline that we're going to bring a lot of people from the community in to talk about. Doesn't have to be, we would call it the full boat ed lab treatment is a big deal. They're typically 70-inch stories, 2,000 words or so, can go a little higher. There's going to be a lot of art, there's going to be video, graphics. That's the sort of the full boat treatment, and they're pretty involved stories. This is one I did. They just came off of the news. We had an initiative on the ballot to reduce class sizes and do a lot more. I'd done some hard news reporting on that. And anyone who's ever covered education knows this class size debate's been around for a long time. The positions are that you can get dueling experts. It doesn't matter, it does matter. I just took a step further and said, let's look at our best studies, Tennessee Star, randomized control trial. Let's say it does work on some level. Why does it work? Has anyone thought about the mechanism? What is it about reducing the class sizes that makes a difference? And so I dug into a couple of some of the big researchers in this area, and there's two interesting answers. One was reducing the class size. Repeated studies had shown that teachers don't really change their behavior in a smaller class. So it doesn't seem to be anything the teacher's doing. Like, well, why were we getting better test scores and stuff? And their thought was student behavior tends to get better. In a smaller class, the couple troublemakers can't hide in the back. I mean, what's the first thing a teacher usually does? If you get a small class of 15 students, like circle the desks up, or you get in a circle, and now it's harder to goof off, right? Because you're front and center. So they were kind of looking at least the initial impacts of lower class size was better student behavior. The other research I talked to from a similar experiment in Wisconsin had also looked at, well, when you reduce class size, when does it work, when doesn't it work? And a lot of the places where it didn't work was where, again, the teacher doesn't change what they're doing. They just teach the same way with the 30 kids as 15 kids, or it's not really a reduced class size. If you put another teacher in the room, but that teacher's doing paperwork in the back, you still have the teacher teaching 30 kids, even though you have two teachers in the room. Or issues with class, with actual physical space. Put a row of filing cabinets in between two classrooms, and we have two classrooms, a smaller class size. And like, yeah, but it's so noisy we can't hear anything. And anyway, so that was that. It ended up being, now some of you will laugh and say, that still sounds like a lot, 48 inches, 1,400 words. It was still a pretty big enterprise story, but it wasn't the full boat ed lab. So we're calling these ed lab light, and trying to do more of those, especially the ones that come off of the news. We started Ed Lab. So Seattle is people very emotional about education, and we've had a long, ferocious debates about education, and a lot of screaming, and there's a real hunger to get a genuine conversation going, and we thought we could be a big part of that, and that's sort of the genesis of it. So here, you start with a story, and then we have we care a lot about engagement, engagement with readers, engagement with the community, and so these are some of the ways that we try to keep that going. These are some of the other ways we do that. We have guest opinions. Here's a teacher from a high school in Seattle. Got a little note from the governor. Hey, saw your story, it was really great. And we try to do these live chats using Google Hangout and some other things. Some of those have gone better than others. I'd say the Google Hangout is a lot of technical. The one I did seemed like, can you hear me? Am I coming through? It's like, oh, so I'm not sure about that. I'll just say, I don't know about that. We do these real life events, which are pretty cool. Here's one we did, inviting a lot of the parents in. From Chicago, we've gone to Chicago to do some reporting on this parent engagement program. Brought in some translators, so this is a pretty cool thing. Then we've been doing these storytelling events, kind of moth-like storytelling events to get more voices of students and teachers. So we had two with students, talking about how they made it to college. And then we did one on why I teach, very popular, where teachers kind of gave up and gave stories about that. And I'll leave this up to tell you about some of our reach. And how much time do I have left? I'm okay? So I'll talk a little bit about this story that you guys read for your homework and what was involved in this. So one of the things that I think Solutions really works well for education is that maybe unlike in some other areas where there's lots of problems, we don't really have a lot of solutions, education is one of those areas where there's 1,000 solutions. Everybody's got a solution. Everybody's got a plan for what to do on Monday to improve education. I think because everyone went to school, they think it must be easy. I was in school for 12 years. How hard can it be? Why can't they fix this? And so here, having a rigorous approach to solutions really matters, because you want to pick out of all the 1,000 ideas the thing that has the best track record, the best evidence, and it works locally for your community. So for this story, I know I want to do something about social emotional learning. It's a very big deal. Lots of people are talking about it. Everybody wants it. And as soon as I dug into it, I found out what's a ginormous umbrella. It covers everything from the kids in the marshmallow test. You probably remember the kids that resist getting the marshmallow. It covers resilience. It covers grit. There's 1,000 buzzwords, lots of different approaches. So I'm kind of searching around. So I found one that had pretty good research, and it was based in Seattle. I thought, okay, let's do this one. And on their website, they even had a local teacher as sort of a character profile of how big a deal it made. This sounds good. Let me follow with this guy. So I call this guy, and he's kind of pretty ambivalent about it. He's like, well, we're doing some other stuff too. And I'm like, this isn't going anywhere. So scratch that, go to the next, and that's how we came across Ruler from Yale, which is really a different approach than some of the others. The one we've been looking at was kind of this box set of lessons. Teachers literally read them off of placards, So, which is good if you're a teacher and you're not sure about any of this, you can just read the lesson and follow along. But the Ruler approach is really this sort of basic culture change where you just change the way that it starts with the grown-ups. It was really focused on that. So we looked at that, and I was interested in Bellevue because and this is where you can kind of get the process in, because they had thought about this other project first too, and they tried it and it wasn't working for them. And then they got to Ruler, and this is working better. And so my time's up? Pretty much, more or less. So let me just finish, and I'll answer lots more questions about all of this. But just a little bragging for us, because we care about outreach, we care about who reads our stories and where they go. And so the story went live on the web last week, around 6, and I got this email at 8:37. I swear this person is not related to the publisher and is not my mother. Hey, John. My girlfriend is a high school teacher at a low-income high school in the Bronx, and I send her the education lab articles all the time. I just read and sent your Ruler article. These articles are a great way to share ideas and really make a difference. The Seattle Times must have the best education coverage in the nation. Thank you. I swear, not my mom. Thank you for devoting your time to such an important and impactful column. And you can see here some of our outreach as well. So we're getting out there. Thank you.
Hey, there we go. Thank you, John. I've actually asked John for access to all his articles because we have a coalition of business and education in New Hampshire. It's about 2 years old, and I want to share all his articles with the members of that coalition. They're great ideas. Noah is here. Noam, I'm sorry. You finally got here, Noam. Noam Levy is an award-winning national healthcare reporter for the Los Angeles Times and Tribune Washington Bureau. His stories about the Affordable Care Act, Medicare, Medicaid, and other healthcare issues regularly appear in newspapers nationwide, and he's been published in Health Affairs in the Journal of American Medical Association, and he's a sought-after speaker, which he's going to do right now.
Thank you very much, and thanks for having me. Thanks for sticking with me. Sixth speaker. I'll, as they say, be sincere, be brief, and be seated. So I'm going to talk to you a little bit about a series of stories that we've been doing over the last year plus, looking at healthcare around the country. It's called Unequal Treatment. And I'll take you through sort of the overall series, and then we'll focus in on one of the stories which I think Tina talked about earlier, which focused on Maine. So the genesis of this story, I cover national healthcare, as I said, for the LA Times. And I've been doing it since 2008. So one of the things doing that, seeing healthcare around the country, seeing the healthcare debate in this country, one of the things that's pretty obvious if you travel anywhere in this country is that healthcare is not the same everywhere in America. It's not even the same everywhere in a state. But my mandate is to look at the big map. And when you go to Minnesota, it looks a lot different than it looks in Mississippi, and not just because it's colder. This is a map from which almost everything starts in the series. And what you're looking at here is variation in a metric called potentially preventable mortality, which looks at how frequently are people dying from diseases that could be avoided with timely and effective medical care. So these are things like kids who die from measles, people who die from diabetes before they're 50. These are, if you have access to a doctor, if you have access to good health care, you shouldn't be dying prematurely. You can see how big the variation is around the country. These are what these geographic delineations are, something kind of technical called a hospital referral region, something developed by Dartmouth, actually, which looks at sort of healthcare markets. There are 304 of these around the country. But if you look through the South, through Appalachia, people are dying a lot more frequently there from avoidable medical conditions than they are elsewhere in the country. Here's to give you a little bit of an indication of how wide that variation is. The best is Everett, Washington, which is north of Seattle. It's almost a third of what it is in the worst, in Memphis, Tennessee. So we sort of came at this and sort of started to think about what's going on here. Why is it that people are dying so much more frequently in Mississippi or Louisiana or Memphis than they are in Minnesota or Seattle or Boston? And we thought one of the ways to think about this is to think about how are you measuring this? How can you get at this question? And one thing that I found particularly useful was to think about this in the context of inputs and outputs. Your output is what you're measuring. So in my case, it's mortality. Maybe for education, it's test scores or graduation rates or crime rates if you're looking at criminal justice. In my case, we said mortality. So that data set, right? You could look at hospital readmissions, you could look at cost, but at the end of the day, people want to know, are they dying prematurely? And we know there's been a lot of talk about something called social determinants of health. Probably talked a little bit about it earlier. And we know that people who are poorer, have less education, are obese, smoke more, these social determinants have a powerful impact on health. But we wanted to isolate the healthcare impact of what's going on. So let's accept for a moment that a poor part of the country, like Mississippi, is going to have worse health because of all the things that are associated with poverty. I'm a healthcare reporter, not a poverty reporter, so this is kind of a personal choice. But I wanted to say, are there things that communities are doing for their healthcare systems that actually may impact this? Do things like rates of health insurance coverage, the availability of primary care doctors, or how integrated healthcare is. Maybe that has an impact. Maybe the way that hospitals organize themselves. Maybe the extent to which people use technology can have an impact, even in places that are poor or poorly educated. So we took this data and we put it together and we started trying to find places that effectively punched above their weight class. Places that were poor or had low education or had high rates of obesity and smoking, and yet still had pretty good health outcomes. This is the idea Christina talks about positive deviance. One of these places is northern Maine. Now those of you who have been there, and we're not that far away, so probably a lot, know, I think I lost my power. Those of you who've been up there know that northern Maine is not Boston. And this is a measure of the percentage of people making less than twice the federal poverty line. Bangor is actually poorer in general, northern Maine, and I guess it's sort of technically eastern Maine, has about the same proportion of poor people as Montgomery, Alabama. But people are living a lot longer in northern Maine. And so to try to quantify a little bit how this is working, we took a look at all the places around the country, the healthcare markets, that had similar obesity rates, similar college education, similar poverty rates, similar smoking. And you can see in each case, Bangor has a much lower rate of preventable mortality than its peers. So the question was, what are they doing up there? Is there something about the healthcare there that's different? And that, and it turns out this is where the sort of shoe leather reporting comes in. Spent time in northern Maine, Bangor, to look at what are they doing there. It turns out that in northern Maine, they have a long tradition, in all of Maine in fact, a long tradition of delivering medical care differently. It's more collaborative. Nurses work much more closely with doctors than they do in other places. It's much less mercenary than it is in other places. There's not a lot of for-profit medicine relative to other parts of the country. They have a long tradition of measuring outcomes. So the health systems in Maine were among the first in the country to actually track what happens to patients, how many diabetics in a medical practice are actually controlling their blood sugar, for example. And I spent some time with a nurse, Sally Patterson, who sort of was emblematic of this particular approach to delivering medical care. And Sally Patterson is a fourth-generation Mainer. She grew up on a farm way up in northern Maine. Her grandfather drove a fire truck in Bangor. She's a former ICU nurse. But she kind of got religion on a new kind of medical care. And she travels around northern Maine visiting with patients who are diabetic, who have mental health issues, to try to intervene in a way to keep them out of the emergency room, out of the hospital. I'm sure any of you who cover healthcare have heard about this general approach to doing medicine. Well, it happens more, it turns out, in Maine than it does in a lot of other places. And so we tried to sort of get at that a little bit in our story, spending time with a nurse like Sally, who's a very compelling character, and with patients, and tried to focus on patients like Gertrude Schump, who was a beneficiary of this particular kind of medical care. And it turns out she is somebody she's actually a refugee from Eastern Europe. Her parents fled the Nazis. And she's traveled around the country a fair amount. And she recognizes sort of how lucky she is to enjoy this kind of medical care. She has COPD, a condition that often leads to hospitalizations. People go to the emergency room frequently if they have trouble breathing. She hadn't been in the emergency room I think in like 4 years, which is pretty unusual for somebody with COPD. So maybe I'll skip over this. I think one of the things which we took, this was obviously a national project, but the principles that we sort of followed, looking at the data, getting to know the data, trying to find places that were unusual, that may have lessons for other parts of the country, can apply, I think, almost anywhere. And in fact, up the road here at Dartmouth was one of the places that's pioneered, for those of you who are interested in healthcare, has pioneered research into geographic variation in healthcare. These are just a couple of great sources which I would direct you to if you're interested in looking at data and trying to identify places that really that can stand out. The Commonwealth Fund, which is a New York-based foundation, does a lot of terrific work on geographic variation. The Dartmouth Institute I just mentioned. For statewide data, the county health rankings, some of you may know that Robert Wood Johnson Foundation and the University of Wisconsin do. Every state, they publish every year, every state data on health outcomes as well as social determinants of health at the county level, which allows some really interesting comparisons to be done within a state, because there's oftentimes a lot of variation, not just from state to state, but within even small states like New Hampshire. And then finally, I direct you to IHME, the Institute for Health Metrics and Evaluation at the University of Washington, which also does a lot of work looking at increasingly at social determinants of health and other metrics at the county level in the United States. And for those of you who are even more ambitious, they do terrific work looking at this globally. So I'll stop there, and I'm happy to take questions during the panel.
Good, Noam. Could I ask, thank you, Noam, very much. That was very interesting. Yeah, absolutely. Why don't you, all the speakers, would you please come up to the table? And then we've got about, we've got about 15 minutes before lunch. So this is a chance for you to ask them questions about what they said. I'd like to ask the first question, and then anybody can answer. This is a wild one. And I'm going to, do we have a second mic? Right there. Okay, why don't you bring the second mic and they can share. Great. Well, I use this one. And it's on. You want to test it? Is it? No, it's not on. You have to push the button.
Yep.
Okay. Here's the question. What's the challenges you typically run into when you start researching a solutions journalism article? What are the challenges that you, maybe common to all of you, that you face immediately when you're starting to work on a solutions journalism story? Is there something that is common thread here? Anybody?
Making sure that the solution, in our case anyway, was making sure that the solution actually worked well enough that you could write about, that it was the best one out there, or at least, you know, not all of them were, but I think we came pretty close to it.
Yeah. Anybody else?
Well, I'm thinking about, I've been asked to do a follow-up on the nail salon story in the New York Times, and that was an amazing feat of journalism that brought up an incredible problem that a lot of people didn't know about. And in the Bay Area, where I'm based, in San Francisco, there actually are a number of nail salons. There's a coalition that helps women unify and work in environments that are safer at the salon. Is that a solution? And is it something that can be replicable in other parts of the country? I mean, San Francisco and New York have a lot in common, but is that enough to say that this can happen in Manhattan?
Yeah. What's enough, I guess, is the question.
Right.
Yeah. Anybody?
I think, again, thinking about radio, making sure you have a good example, like somebody who can really express what's going on that people can connect to, that can help tell that story.
Yeah.
Yeah, I'd say on just a practical level, it's like I said, for our EdLab stories, the full deal is you need to go into a school, you need to find real people, and you need to find, you know, just the basics. Art, what are we going to have for video? What are we going to do for our graphics? And so, like I said, in education, there's a thousand solutions, but it may not be the one that's the one with the best evidence might not be the best one to tell. So trying to meld that all together, what's the best story, what's a pretty good solution, even if it's not the absolute best solution, based on, you know, what's in the news and what we're trying to do in Seattle.
Yeah.
I guess I would just add, you know, I talked a lot about data, and I think it's absolutely critical to have good data and to know your data very well. But then coming out of that, I think one of the challenges which I wrestle with is it's also really important that you hide a lot of your research, I think, at least in my sense. Because you know, it takes a lot of work to look into a program to get to know the academic literature. But most of your readers don't want to know all that crap. But you need to write with authority, so you need to, you know, I credit my editors actually more than me in insisting that the articles that we did in the series and in general are not overburdened with too much data, too much academic research. It needs to undergird everything that happens, but then let the stories, which are much more compelling, actually tell the story.
Yeah, the old adage of tell the story, right? Yeah. Where would you like to direct your question? I'm going to run over to you.
Could be for anybody on the panel. So solutions-focused journalism obviously points out a solution to an issue, but it doesn't prescribe that the community do anything or an individual do anything. But I'm wondering whether you have either partnered with your editorial department who could maybe very powerfully say that the community should do something through an editorial or through an editorial series, or even as an individual journalist, how you feel about maybe blogging kind of in a companion piece where you're actually expressing some of your opinion or your thoughts, or being in an event, like you said in Seattle, where you could potentially express your own opinions about what the community should or shouldn't do. So I'm just curious about that line, either within the institution or within your own, presentation of your reporting.
We don't express our opinions. It's actually sort of important in Seattle. We have an editorial board that has very strong opinions about education that not everyone agrees with. And we also have, I'll just bring up sort of the elephant in the room, we have funding from the Bill and Melinda Gates Foundation, headquartered in Seattle, very big player in education. And from the outset, we made it clear to readers, we made it clear to our newsroom that the Gates Foundation would have absolutely zero say in anything we did, would have no chance to review anything before us. They had to read it along with everyone else. And actually they wanted that too, because they didn't want their credibility at all questioned about even supporting something like this. But, excuse me, for those reasons, our editorial board is our publisher is more than happy to express opinions in education. We don't.
Anybody else want to answer that?
Yeah, I just think there's some, I think I definitely make some value judgments in my reporting. For criminal justice, I think it's like a bad thing that we imprison more people than any other country in the world, and things like that. I don't have a trouble, just like I don't have any qualms about just sort of assuming we're all on the same page that like human suffering is bad and mass incarceration is not the best solution to societal ills. And I think that kind of is helpful in writing a solution story. Is you have we all can agree that like suffering is bad and death is bad, so.
Anybody else?
I can definitely relate to that. I just assigned 2 stories about unaccompanied minors in the United States, and we've come on this year when we had this large wave of young kids come up from Central America, and they're in the school systems now, and I assigned 2 pieces to compare and contrast, thinking with the solution journalism mindset of where have things gone, where were things really rough, and where are they now, and where were things going relatively well when it came to integrating these kids? Where was an area in the States that actually integrated these kids well? But of course, there's an enormous amount of judgment when it comes to these kids, whether they should be here or not, and what their parents were doing, bringing them up through smugglers, and that's just, they're here. So we start from that departure point. And I think that there's issues, there's federal funding issues that'll be a part of the story, but what is implicit is that the kids are here, and whether you like it or not, they're a part of the school now. So I think it's important to keep that in mind, not get too mired in the judgment part of it.
Another question, yes, Tina.
This is a question for Greg. You, in your Blight story, not only went to Atlanta's East Lake, which has a long and successful history with their programs, but also to Spartanburg, which was just starting out, and that allowed you to put 2 different perspectives on the same program, the same idea in the story. Why did you do that? Why did you think that was important?
The East Lake Country Club is at some point, probably in the 80s or 90s, it almost went bankrupt, and then the big philanthropist came into town and redid it, and now it's the final FedEx Cup championship golf course. And he poured a ton of money into this East Lake community. They have a YMCA is connected to the school. They're building that. When I was there, they were building a high school there. So it was interesting what they did, but I didn't feel like it was totally relevant to what we could do. Spartanburg it had a private college that had moved in, so it had an advantage over us too. But I thought comparing Spartanburg to Fayetteville was much more accurate.
Yeah, Matt.
I'm going to put my evil editor hat on for a minute. Thank you for giving this a name, because at B&H we just called it So What. That's the problem, so what's being done about it? And we've been trying to do more of this, and this is inspiring us to do it better, but it takes a lot of time, resources, and money to do it right. And that's where we've come up against a wall with it. And we've been trying to see what are some ways to get around doing that for the stories that we feel are kind of beyond our financial reach to do properly, including possibly partnering with other media outlets, which is an interesting dance in itself. How do your organizations go about allocating the resources for this? It's great to do it, but I don't have the budgets that you do. So how does an organization like mine go about doing this effectively, but in a way that doesn't break the bank?
Anybody?
So I can tell you, so our series required a lot of travel, so it was fairly costly. But two thoughts for you. One was there's increasingly a huge amount of grant funding that's available, and our project was funded in part by a grant fellowship from the Association for Healthcare Journalists, which is obviously focused on health journalism, but there are similar foundations. It sounds like Gates has been involved with Seattle, so that's number one. And number two, I would submit to you that, I mean, if your newsroom is very small, obviously there are huge amounts of time pressures, but I would submit to you that the kind of data mining that I was talking about here, which is not you don't have to create huge databases and get data people to run, formulas on billions of records. This stuff is pretty basic kind of Excel spreadsheet work. And I feel that it's part of a sort of basic beat responsibility to sort of know your beat, know your community. I mean, if you're covering education, you ought to know what your school's test scores are. If you're covering healthcare, you ought to know what the hospitals in your community are doing. There's so many data sources that are now available. I think it's not unreasonable to sort of expect that journalists would have that data. And once you have that data, and once you know it, you live with it, you see stories that don't require flying off to Hawaii to see how they're doing it there. I mean, I think that many stories become evident by sort of just seeing the patterns that exist in stuff that doesn't cost any more than signing on to the internet.
And I agree with that, and not to be dead horse. We work a lot with data. We're a B2B publication. Data factors in a lot of what we do, and we do a lot of in-depth stories based on that. But there is that time commitment. We are a small staff, and so when I send off my associate editor to do a story, or I'm taking on one, there's still everything that needs to get done. And so there is that cost factor that comes into doing it properly, and you can't do it just on data alone. The data is the starting point. But like you said, I mean, these are all fantastic examples you gave us because you did go in traveling, you did go to places. I would love to be able to send a reporter to say, okay, we want to do passenger rail here in New Hampshire, and we're coming across all kinds of problems with it. I was just in Florida where they celebrated the first year anniversary of it. Let's do a comparison. I can do that by phone to a certain extent, but the type of stories you're doing, the type of stories that we want to do more of here, is that grant money really kind of the big source? Are there advertising routes that publications have been able to go to fund these sort of things that attract advertisers more? We've done stories that have been very compelling with our readers, get a lot of talk, get a lot of media, but don't necessarily get extra advertising dollars come in that pay for us to do that. And if you do start working with grants, what are the expectations around that, and how do you make sure you're keeping your editorial independence without being beholden to someone who's giving you money to do it?
That was the question I was going to end with. You just asked it, and that is, how do you keep a wall between the funding of a solutions piece and your editorial independence? With some of what you're asking, Matt.
Yeah.
Who wants to tackle that one? You mentioned the Walton Fund.
I think, figuring out what your funding options are and who you want to work with is helpful. So I have zero oversight from the foundation that funds my position. They'll come and visit. They're interested in what I'm doing. They're funding lots of different people in the Gulf Coast post-oil spill. And they happen to be really informed on the issues too, so it's interesting to meet with them. They're in Washington, so I actually learn things when they come down to visit me. So they're keeping an eye and they're listening, but nobody's ever told me what I can and can't cover. You know, if Walmart was part of a story, I doubt that they would tell me I can't include that. I think getting involved with Solutions, who helped fund my trip to Vietnam, actually helped me really frame what I wanted to get out of that trip and how I wanted to share the solutions I saw in Vietnam with the local audience, because that was a real challenge. Like, how do I get people in Louisiana to connect with this example that's far away? And to your previous question, I think just the sources I go after now, I mean, I'm part of a news department that started 2 years ago. It's a post-Katrina thing. It's me and a news director, and we've since added an education reporter, but it's the sources I'm trying to develop. It's inherent in kind of covering climate change. I think it's really just a piece of, as Tina said, doing good reporting. It doesn't always have to be so obvious or take a long trip. It's just kind of, you know, including that aspect to a good story. It's balancing it out. And, you know, I'm covering an issue that in a state where both senators are climate change deniers. So I'm simply, by reporting on this stuff, I'm somewhat disruptive.
Anybody else want to tackle that one?
I would just add that my piece that was Solutions-y on the Veterans Court is probably one of the cheaper stories I've worked on, and my editor loved that because it was in New York. So you can also look for people who are experimenting, trying new things in your own community. You don't have to look for another place that's doing things better.
Greg?
We spent a lot of money doing this, and then we just laid off 17 people. But it wasn't all my fault. But the point here was you can go, you know, to other places. We had about 3 weeks ago, we had a homeless guy stab another homeless guy at the library, and it led to the conversation in town. You know, the homeless people are taking over our library because they didn't have anywhere else to go. So I looked at my boss and I said, there should be a good solutions journalism story in that. And he said, yeah, I like that. And he signed a reporter, and we went to Greensboro and spent the day there and came back. And she wrote just a great story on how Greensboro had done this day reporting center where these people were going to spend the day and learn how to get a job and connected with social programs. It was pretty good stuff. And I also have to tell you, I have to go. I got a plane to catch, so thank you.
Okay. Anybody else want to answer that one? Yes.
Well, I think it has less to do with financing than it has to do with story selection and changing the mindset. And I don't really think about these stories as being more expensive. I think about them being undertold, and that it's a matter of, we get slammed with so many stories that are happening, especially at the world, everything that's happening that's awful, and, you know, Nepal, Baltimore, the list goes on. But how can we counterbalance these stories with things that also leave our listeners scratching our head about projects that should be more common in the
Greg,
world?
thank you. We thank you.
So I think it's just a matter of story selection and less about financing.
Anybody else?
Piggyback a little bit on what Noam said. It's probably true of any kind of story. Certainly with investigative stories, you can't really afford a dry hole. So you have to really have your background, really know stuff, and when you feel like you've got it, you know, it just, and I don't think there's a newsroom in America now that can afford to spend 3 or 4 weeks on something that doesn't pan out. So you got to really, in the good old days you could. I mean, that was really good investigative journalism. You had to be willing to blow 4 weeks on something that didn't pan out. And I wish we were back in those days where we could do that. But now it's so tight. You got to really make sure you have it. And the best way is, like what Noam said, just have this great background knowledge and really know your data. Really, and then when you see something, you're like, all right, we can do that. And make sure. I know that I already used to suggest, you know, pitching to editors your minimum and your maximum. Like, if we do this, the minimum story we'll get is this. And if it really turns out the way we hope, it'll be maximum. and then they can decide where in between that, how much are they willing to spend on it. And I mean, we spend a lot of time about selecting stories so we don't get that dry hole.
On purpose, I went 5 minutes over because this is a great panel. But I want to thank Noam, John, Jesse, Liz, Monica. We just thanked Greg going out the door for a terrific morning of Sojo. Thank you.
And thank you very much